Good afternoon. Hello, friends. I'm Dr. Pankaj. I'm basically ENT surgeon, run an ENT hospital based at Lucknow, and I also have Hyperbaric Oxygen Therapy Center, which is a different place from the ENT hospital because that caters all, as all you know, all the specialties of the medicine, and that is run by Mr. Sandeep Srivastava and Mr. Sachin Srivastava, who are trained very well in hyperbaric treatment, and we are running it for last 4 years, which is benefiting the state that this is a large state of Uttar Pradesh, and we are the first and only we have been giving this form of therapy in the state. I apologize personally not being there, and I congratulate the team for arranging such an good conference. This will definitely benefit all the physicians attending the conference, and this will increase the awareness all over India, and which will further benefit all those patients who are partially or not being benefited by the modern medicine. I'm presenting here the patients which are most problematic in our specialty, that is sensory neural hearing loss, which is sudden sensory neural hearing loss. And we usually had no definite medicine or definite therapy which could help these patients. And usually, these patients, most of them were permanently handicapped unilaterally or bilaterally. Of course, we have options of hearing aid and cochlear implant, but that is too costly and that is not the natural remedy. Hyperbaric oxygen therapy has given us a dramatic improvement. Of course, we add all those medicines or therapy which were prevalent in our ENT branch, and adding hyperbaric oxygen therapy for 7 to 21 days has definitely improved the percentage of patients which are benefited by this combination of therapy. So I am presenting here hyperbaric oxygen therapy in sudden sensorineural hearing loss. I am Dr. Pankaj from Lucknow. Lucknow Hyperbaric Oxygen Therapy Center is giving treatment to all those specialties, including plastic, diabetic foot, sensorineural hearing loss, burn patients, comatose patients, and everyone. So we are benefiting all those patients for last 4 years. So what is the definition of the sudden sensorineural hearing loss? Sudden sensorineural hearing loss is said when the patient or a person is having acute hearing loss which is of sensorineural type and which is on audiometry more than 30 decibel, and which happens within 2 or 3 days period. It is a medical emergency in which, if it is not early diagnosed or any treatment is given, this will lead to a permanent hearing loss, which is a permanent handicap. It may be unilateral or bilateral. Coming to what is sensory neural hearing loss. So, ear is basically divided in three parts: outer, middle, and inner ear. Outer ear is wholly a canal, it's a mechanical way to convey the sound. Then there is a middle ear which is purple in color. This includes tympanic membrane and three ossicles in a series. So there's mechanical energy in the air, which is air vibration, is finally conveyed by membrane and ossicles as a mechanical energy and presented to the inner ear. Now, inner ear, which is blue in color, it contains fluid, which is perilymph and endolymph. Blue is perilymph and green is endolymph. When the mechanical energy is conveyed to the inner ear, the perilymph vibrates. The vibration are conveyed to the fluid, and this fluid, when the perilymph vibrates, endolymph also vibrates, and there are hair cells by the pink color. And when the perilymph vibrates or endolymph vibrates, the hair cells bend. As soon as they bend, there is a generation of energy, that's an electrical energy, and by tiny fibers this is conveyed to the brain by eighth nerve, which is called acoustic nerve. That is how we hear. What happens in sensory neural hearing loss or sudden sensory neural hearing loss? There is a supply, blood supply or oxygen supply diminution or damage to the hair cells, and that's how the hair cells are partially or fully damaged. So every vibration which is conveyed to the middle ear or finally to inner ear is not being, the electrical energy is not being generated, and that's how the patient becomes partially or completely deaf. Incidence is 5 to 20 cases per lakh. This is only sudden sensorineural hearing losses cases. Other sensorineural hearing loss or other causes of loss includes much more than that. What is the etiology? Till now, we are not clear that what includes or what causes sudden sensorineural hearing loss. So we call them idiopathic. Idiopathic means no definite cause is not known. Yes, definitely some causes are there which we have proven that they may be the cause of sudden sensorineural hearing loss. That is vascular compromise. It is like a stroke to the brain. So it's an stroke to the ear. Now, ear has got two small arteries which are called end arteries, means there is no cross connection between them. So, if there is any clot or hemorrhage or just a spasm of the artery which blocks the arterial supply to that particular organ or the inner ear, the other arteries which are patent will not supply because there is no cross connection. These are called end arteries. So there will be a damage to the inner ear or hair cells and causing the sensory neural hearing loss. Autoimmune means there is a sudden inflammation or swelling in the part which damages the hair cell. So autoimmune is a different group, and this is followed by infections. Infection mostly are viral or bacterial infections are also there. So when we identify the cause, this does not come in idiopathic one, and this may be sensory neural or a chronic one. We are dealing here with sensory neural, which is acute type only. What can be the clinical presentation? Usually patient gets up in the morning and there is sudden notice of hearing loss or hearing impairment on one side. It may be bilateral, which is very unusual, and patient hears a sound, an abnormal sound or fullness in the ear, which is called tinnitus. Very rarely or in other causes there can be associated vertigo also. How can we test? So high suspicion should be there by the clinician as well as by the patient, because 2, 3, 4 days or 1 week is lost when the patient thinks that this is maybe a minor problem and this may improve. Or clinician, if they don't suspect, they keep on giving some medicine, not considering sensory neural hearing loss. And when the time has passed, there is no remedy and there is a permanent loss. So simply, if the patient comes and we examine the tympanic membrane, which is intact, there is no wax or something, there is no infection, inflammation or fluid, so we do a tuning fork test. It's a simple, very cheap instrument which we can confirm sensorineural hearing loss or conductive hearing loss. After tuning fork test, when the clinician suspects sensorineural hearing loss, audiometry is another test which is most important, very cheap and available all everywhere, which actually documents the variety of hearing loss, means sensorineural, conductive or mixed, and the grade of the hearing loss. What exactly is the grade? Mild, moderate, severe, profound or stone deaf. That is recorded in decibels in each frequency separately. Then we simply do some routine blood investigations, and if we suspect any brain problem, radiological investigations like MRI or CTs. And this is an audiometry which when we see, the left side is depicted by blue and the right side is depicted by red one. So we can see the initial audiogram. The right one, the patient had got a right sudden sensory hearing loss which was profound, and after treatment, after some few days, patient's hearing improved. This is recorded in decibel. Decibel means 1 decibel is 10 times the initial hearing. So we had a study in our hospital and association with the Lucknow Hyperbaric Oxygen Therapy Center, and total 39 patients were included, which uh, fulfilled the criteria of sudden sensory neural hearing loss, which was more than 30 decibel within 72 hours. All were unilateral. All age group were included from 22 years to 57 years, and there was no other associated stroke brain problem, vertigo, or any other cause which could lead to hearing loss. They all were given intratympanic steroid as a routine when patients come to us. Intratympanic steroid is given once a day for 5 days, and all were given simultaneously hyperbaric oxygen dives, which was from 7 to 20 day, 1 day's average, depending on which patient had a early recovery, or if they didn't want to continue the HBOT. 65% of patients had more than 15 decibel improvement within 7 days on the combination of two treatment were given. And after further 14 days, 28% of them had more 35 decibel recovery, which is a very good result compared to previous papers which are available in our journals. In conclusion, sensorineural hearing loss is missed most of the time by the patients or clinicians, thinking that there may be a minor problem that will improve. So any hearing loss which is perceived by the patient within short span of time should be consulted by a specialist, and at least an audiometry should be done early, because if the time passes, there is no chance of recovery. In modern medicine, there is no definite management for sensorineural hearing loss, which is sudden type, and steroids, antiviral, some vasodilators, and with the plenty of fluids are given. And now HBOT has come to as a boon for these patients, which is giving a good result, which is added to our modern medicine treatments. Thank you, and I wish all of you to have a wonderful conference. Enjoy. Thank you.